Understanding eligibility. Alabama's Breast and Cervical Cancer Early Detection Program, referred to by many as ABC, saves women's lives. It helps clinics provide breast and cervical cancer screening at no cost to the patient. It's easy to get up and started and running in your clinic. Before you get started, it's important to understand who the program can help. ABC is a program for Alabama women ages 40 to 64 who are uninsured or underinsured and meet the specific income guidelines. How do women figure out if they're eligible? Women can call the ABC patient hotline at 1-877-252-3324. And if they're eligible, our nurse will refer them to a contracted provider in their area. Also, clinics can screen women for eligibility themselves. All they have to do is ask patients a few questions. The first question is the patient a woman? The answer should be yes. Men aren't eligible for ABC services. Breast cancer in men is rare, and men with symptoms should see a doctor. The next question is, does the patient live in Alabama? The answer has to be yes. The program serves Alabama women statewide. Every state has a screening program like ABC, and women who live outside of Alabama should contact ABC's hotline at 1-877-252-3342 to be referred to their state's program. The third question is the patient uninsured or underinsured? If a woman doesn't have insurance or has insurance with high copays or deductibles that she can't afford, then ABC can help. Question number 4 is the patient's income within program limits? Figuring this out is easy with our income eligibility guideline. They don't need to show pay stubs, tax returns, or any other proof of income. If the household income is less than 250% of federal poverty levels, the woman qualifies. Here's a look at the 2023 guidelines. The income limits do change every year, but not by a lot. ABC usually announces new guidelines every February. You can always find the latest information on the ABC website at alabamapublichealth.gov. And finally, question 5 is the patient between ages 40 and 64? That's the age span ABC screening usually covers because women younger than 40 generally face lower cancer risk. However, there are 3 exceptions to this age limit regarding cervical cancer screenings. The first exception is Medicare usually covers women 65 and older, so ABC doesn't pay for their services unless they have Medicare Part A only or do not qualify for Medicare and meet the other program guidelines. The second exception is women who are between the ages of 21 and 39 who have had a bilateral tubal ligation or hysterectomy are eligible because they are not eligible for family planning services. The third exception is women who are between the ages of 21 and 39 who need follow-up services for abnormal cervical cancer screening. So now we know who's eligible. Let's look at exactly what ABC provides. It covers breast cancer screenings, which include yearly clinical breast exams and mammograms, and cervical cancer screenings, which include PAP and HPV co-testing every 3 or 5 years. ABC covers more frequent testing for women who had abnormal pap smear results in the past, and of course, ABC covers follow-up diagnostic services. What kinds of diagnostic services does ABC provide? It covers follow-up mammograms, breast ultrasounds, surgical consultations, office visits, breast biopsies, and the pathology necessary to analyze them. It also covers the follow-up cervical procedures such as a colposcopy and, if necessary, endometrial biopsy. Other services are sometimes covered when needed to detect cancer. If you are wondering if something is covered, just ask. Keep in mind, clinics enroll women for these services even if they did not come to ABC for their initial screening. Remember, ABC is about breast and cervical cancer screening. It can't cover every medical service a woman might need, and it's up to the clinics to check with the ABC provider manual and to tell patients whether a recommended service is covered by ABC. Patients must agree to pay for the uncovered services prior to them receiving them. Also, for ABC services, clinics must accept Medicare rates and not bill patients for the difference. Any questions? Just call the ABC program at 1-877-252-3324. Thanks for taking the time to understand the ABC eligibility. Protecting women from cancer requires all of our efforts. We're grateful to you for joining us in saving women's lives.